This is Dr. Scott Kenny from Integrated Physical Medicine. I am the co-owner of Integrated Physical Medicine. I'm the clinic director of the new Lenox office. Thank you in advance for continuing to watch the videos. Before we get started, do me a favor, tap your screen, hit the like button, start tagging your friends and family and loved ones who might benefit from some of the things that we do in this office. We get a lot of inquiries these days about people calling up for acupuncture and dry needling. So I wanted to spend a few minutes talking about the differences between the two of them and then do a very quick dry needling technique for you guys to hopefully address some of the questions, concerns, and comments and some things like that that we address daily in the office. First things to start with, acupuncture and dry needling are two completely separate things. Either way though, very safe, very gentle, and what's most important in my opinion is of course very effective. I got my fellowship through the International Academy of Medical Acupuncture back in 2005 and started taking some dry needling certifications last year in 2019. From my own personal preference and from the things that I feel like we've gotten the best successes with is actually dry needling techniques. If we're looking for something very quick and effective to reduce pain, dry needling is one of the routes that we want to go. Okay? Our model here, Jackie, let's just say that she has some lower back problems. From an exam point of view, we found that she's got some trigger points in her quadratus lumborum muscle, and that's referring into the glute muscles as well. So what we're going to do and demonstrate is a quick dry needling technique to demonstrate how we would go about treating those things. Few seconds about differences between acupuncture and dry needling as they are completely separate techniques. Acupuncture, for example, everybody watching this video has the same amount of acupuncture points. Large intestine 4, for example, right where the finger and the thumb meet. We needle that point from everything from people who have neck pain, headaches, butt pain, elbow pain, knee pain. It's a great point to deal with pain. Okay? Trigger points. Okay? A trigger point is basically a region of the muscle that refers pain. For example, when I examine Jackie here and I push and I dig deep into that quadratus lumborum muscle, she gets a referral pattern down into her butt muscles. Okay? Dr. Janet Travell did a phenomenal job about mapping dermatomes, or not dermatomes, but trigger points when it comes down to spasm muscles, and at least with the quadratus lumborum, one time when people come into the office saying they have butt pain, might not be a butt problem, it might actually be a quadratus lumborum problem. Okay? So from an exam point of view, we demonstrate that we have trigger points in that muscle, so then we go in and treat. Okay? Questions that people have when it comes down to needling. People always say, does it hurt? Okay? There will be a small little pinch, but a lot of times it's not anything that a person hasn't felt before, and to be honest with you, sometimes they don't even feel anything. Okay? When we get the needle directly into the trigger point, let's say that this muscle's a knot, okay? We insert a needle right into this trigger point. That muscle, that reaction basically is to get the muscle to relax, okay? And that's exactly what we want to feel. Okay? Blood, a lot of times people ask if there's blood. Most of the time there's not any, and if there is any blood, it's nothing that a quick little cotton swab to clean up the blood will go. Okay? Treatment times can last anywhere between a minute to 25 to 30, even longer than that as well, depending on our goals and depending on what we're looking for. Okay? First things first, from a treatment point of view, we're going to palpate. Okay? We're going to go, and in this case, we're going to dig deep into the muscle, and at least from here, when I push on this muscle from our exam, she's got a little bit of a referral into that butt muscle, so that's kind of the region that we want to go. Okay? We're always going to clean off the area with some rubbing alcohol. Our needles, of course, have never been used. A lot of times people reference things that they've seen on movies, and the needles are actually very small, very bendy. The package is actually sterile until you open it up. Okay? This is a 2-inch 36 gauge filiform needle. All that means in English is that there's no hole. It's not a hypodermic needle where we're injecting fluid or anything like that, and there's no chemicals on this needle. Okay? From a treatment point of view, we're going to palpate that spot. We're going to find our trigger point. We place our guide tube down, tap, got a needle in there. Okay? We're going to insert the needle. She's doing great. A little bit of a twist. And we'll kind of go up and down and do a little bit of pecking with this needle. And that's our first needle. Okay? We are going to insert another needle into here as well. Options-wise, we do have the options of hooking the needles up to an electric stim unit as well, which does help to get some deep muscle stimulation. Needles in her case going nice and easy. When we hit that trigger point, she'll feel that little bit of what I kind of say is a little bit of a, we know we got it in the right spot, and that's our treatment. Okay? And removing the needles, basically pull straight out, and then of course dispose of our needles accordingly. And if everybody's worried about blood, there's of course no blood. That's our treatment and that's our video. Thank you everybody for watching. Again, tap that screen, hit the like button, share. We appreciate your business and we appreciate you letting us continue to take care of you. Stay safe, stay healthy. We'll all get through this together. Thank you very much.